Hello, my name is Dr. Richard Thomas. I will be presenting an educational discussion on the thyroid. Some of the topics we will be discussing are: what is hypothyroidism or low thyroid function? Do I have it? Do I need thyroid medication? What if thyroid medications haven't worked? And I've been told my thyroid tests are okay. Why do I still feel so bad? Thyroid function is complex. It involves the hypothalamus, which is in the brain, the pituitary, which is in the brain, the thyroid gland itself, various enzymes, T4, T3, the liver, and the gastrointestinal system. If there is a problem or dysfunction in any of these areas, it can affect the thyroid, resulting in low thyroid dysfunction. It is important to understand that T3 is the biologically active thyroid hormone, not T4. T4 must be converted to T3 in your body or you will suffer from low thyroid dysfunction. What this means is that your T4 level can be normal or even high, but if the T4 to T3 conversion is impeded, the person will likely suffer from the symptoms of low thyroid dysfunction. Now, let's look at an example. Say you've been suffering from one or more of the symptoms of low thyroid. You have had your TSH and T4 levels checked and you've been told they are normal, but you still feel terrible. What could be going on? One problem it could be is that the T4 is not being converted to T3, the biologically active thyroid hormone. Things such as liver problems and gastrointestinal problems could be doing this. You see, most T4 is converted to T3 in the liver and the gastrointestinal system. Health issues in either the liver or the intestines can adversely affect the T4 to T3 metabolic conversion. Other health issues, like adrenal stress and selenium deficiency, can also affect this conversion. Oral contraceptive use can affect thyroid function, lowering it, as can synthetic estrogen replacement therapy. Another issue that can result in low thyroid function is chronic stress. This is called thyroid resistance. In this situation, the pituitary and thyroid glands are fine, and so are the hormone levels, but the thyroid hormone is not getting into the cells of your body. Why does this occur? Well, chronic stress responses stimulate the adrenal glands to produce too much cortisol. Too much cortisol causes your body's cells to be resistant to thyroid hormones. The thyroid hormones can't get into your cells to do their job. The result is low thyroid dysfunction. Since all of the cells of your body have receptors for thyroid hormone, the symptoms of low thyroid can be quite extensive. Some of the more common symptoms are fatigue, weight gain, morning headaches, depression, constipation, sensitivity to cold weather, poor circulation and numbness in the hands and feet, muscle cramps while at rest, one who gets sick easily and has difficulty recovering, wounds that heal slowly, a requirement for excessive amounts of sleep, chronic digestive problems, itchy dry skin, dry or brittle hair, hair that falls out easily, loss of the outside portion of the eyebrows, and edema or swelling, especially of the face. Autoimmune thyroid, or Hashimoto's thyroiditis, is the most common cause of low thyroid dysfunction in the United States. In this situation, your immune system is making antibodies against your thyroid gland, damaging and destroying it. The result is low thyroid dysfunction. This is an immune system problem. The immune system must be properly evaluated and treated, or the low thyroid dysfunction will progressively worsen over time. All too frequently, I see cases where thyroid hormone replacement is the only treatment given in autoimmune or Hashimoto's thyroiditis. The cause of this condition, the immune system, is never evaluated, let alone treated. A common scenario in this case is the patient requiring ever-increasing amounts of thyroid hormone replacement. After a period of time, a return to the symptoms of low thyroid dysfunction, despite the thyroid hormone replacement, occurs. This should make sense to you. Your immune system continues to make antibodies against your thyroid gland, causing more and more damage to it. At some point, there may be so much damage done that thyroid hormone replacement becomes largely ineffective. The problem is with the immune system, not the thyroid gland. The immune system must be evaluated and treated. Research has also shown that a rather large percentage of people with autoimmune or Hashimoto's thyroiditis have a cross reaction. That is, their immune systems begin making antibodies to other body tissues. Can you now see the importance of evaluating and treating the immune system? When should you suspect that you may have an autoimmune or Hashimoto's thyroiditis? Number 1, if you have mixed symptoms of hyperthyroidism and hypothyroidism. Number 2, if you have little or no response to thyroid medications. And number 3, if there is a consistent need for you to increase your thyroid hormones. What should you do if you suspect that you have low thyroid dysfunction? Understand that thyroid dysfunction is a sign of metabolic dysfunction, and in-depth testing is a must. It is important to find the root cause of your thyroid problem. You want the cause of your thyroid condition treated. You want metabolic problems treated, and, if possible, prevent the progression of autoimmune processes to other tissues. You do not want a Band-Aid approach. If you need help, if you want an in-depth holistic approach, you may call my clinic at 937-252-7011. Thank you.